And for everyone else, if you are ill, take a sick day. If you have a bereavement, take a sick day. These things are enshrined in law to make sure we are protected and supported. Right?
My name is Alexia and I'm from Nolan, and we have, we're incredibly grateful to have been invited into this space by the Young Africa Centre to talk about sickle cell disease and also the importance of signing up to the stem cell register.
Hi, my name is Nikki Fagbemi. I'm a writer and actor, and I'm having such a great time today at the African Centre Sickle Cell event. It's so important having this event to normalise talking about sickle cell, creating a safe space for people to learn and ask questions. And tonight I've also learned so much about bone marrow and then about the procedures of like saving someone's life, and it's been really educational, and I think more people need to know about the actual procedure.
So when we talk about our sickle cell warriors who need bone marrow transplants and can currently get it from related donors, there's a limited chance of matching, and we can add efforts by becoming registered. So when they're in need and access to treatments from unrelated donors, guess what? There's people there.
My artist name is A-Star. I was on the panel today for the Sickle Cell event. It was a great event, especially hearing from ACLT and Anthony Nolan about how to donate stem cells, and also hearing the story of people getting stem cell and bone marrow transplants. I just want to say to people, if you can, please sign up to donate blood, donate stem cells, and donate blood, bone marrow if you can.
Hi, my name is Charmaine Jean-Paul from Rebel Led Training. It's been great to come to this event, and I'd definitely say one of the things that I've learned in coming to talk about all these issues to do with health within the Black community is that volume is necessary. Talking about our stories and talking about them loudly is crucial in order for there to be real change.
Good evening, hi, I'm Sabrina Jarrett. I'm the National Development Manager for the African Caribbean Leukemia Trust, but I'm also a lifesaver in waiting and a regular blood donor. And that's important to me because I like to save lives. I did forget my cape tonight, should have remembered. But this event is great to be here because we get to showcase the work that we do, but also raise awareness in the community with our type of audience, so people from the African Caribbean heritage. So I think it's fantastic. I hope people learn something today that they get to take away with them to continue talking, having these discussions, but most importantly, changing and shaping lives.
Aside from having crises, I've only ever had issues with my spleen. I had to have that taken out. So for me, it was really the physical manifestation of the pain and everything. But for me, it's completely stopped. I have to say that I don't have the pain anymore, and like you said, it's you can't really imagine it. And for the first few months, I had the phantom pain, so I couldn't. My body wasn't even used to the fact that I'm not supposed to be in pain or anything like that.
How does sickle cell define you, and how do you define yourself with the condition and the factors?
It doesn't define me. It's a part of who I am, but it's not me. Like it's a part of my story. It's not my story, and it's something that I had to. It took me a while to get there. Before I'd say my awakening, probably about 2020. I felt like I used to hide my health because I didn't want it to be my identity. But I felt like because I was desperately trying not to have this illness my identity, it became my identity because I was just suffering in silence and not living the life that I should be living. So now just me accepting that it's a part of me, it's allowed me to just own it more and just understand that this doesn't define me. If anything, even though it's such a painful disease and you have to go through so much, it's contributed to so much, like my sense of humor, the way my relationship with death, like just my relationship with life. So on the flip side, I think it's actually given me so many things that I probably wouldn't have. Or sometimes it's like my point of view, the way I connect with people. And sometimes I have to sit with myself and I think, will I be this empathetic, or will I be able to connect with so many people if I didn't have this condition, or will I just be so kind of like just ignorant to people's pain? So it's something that has been a positive thing in my life all the time.
One thing I always say is that I have sickle cell doesn't love me. So I always have that outlook on life.
Yeah.
And just to say, well, I grew up with sickle cell affecting me in school, college, uni, so I didn't get the best grades. Unfortunately, I was always in and out of hospital, in other countries for specific treatments. So it kind of did affect me in all areas of my life, but thankfully, you know, I'm able to sit on panels and go to schools and do workshops to speak about sickle cell. So it's made me more empathetic as well towards people that have sickle cell and any other chronic illnesses as well. I grew up in a single parent home with me and my mum both having sickle cell. So there'd be times where I'd be in hospital and I would leave my ward to go visit my mum in her ward. So we both kind of got to really understand each other in that kind of sense. And I had to care for a mother that has sickle cell. She had to care for a son that has sickle cell. So I'm very much more empathetic towards other people that have any type of illnesses, but also parents that have to care for children that have sickle cell, and children that have to care for parents. I did a school talk a few weeks ago, and there was young people that came and said that they had a mum that has sickle cell. So a specific young person had 4 other siblings that didn't have sickle cell, but their mum had sickle cell. She's a single mum, and they all had to care for her. So you get to hear a lot of people's different stories, and kind of be encouraged by their stories, but also be encouraging to others.
Thank you.
I don't have the lived experience. I do remember though that having 3 other siblings, so there's 4 of us in my household, 1 brother and three girls. And my mum, she never knew which 2 had the trait. 4 children. She never knew. She knew 2 children had the trait. She never knew which 2. And that is based, and this is probably why we still need these conversations to happen, because these 2, and I know who they are, my older brother and sister, these 2 needed to know this because it carries their weight and their journey through having children and family parenting. But I would say it doesn't define me because I don't have a lived experience, but as patient advocacy, it definitely defines the work that I do. Because just by having that lived experience tells me enough about what's more that needs to be done.
Thank you. I'm noticing there's a theme of empathy, and I think one thing we can take away is that you never know what people are going through when you see them. Like, you don't know regarding their mental health, their physical health, neurodiversity, and I think I'd like to thank you for just being open. And going to our next question, what is it like managing it? How do you live with it? And obviously for you, how is that with your family?
So for my family, it's quite different because for me, working in the field, it's always normal for me to make it a constant reminder to ask questions when you're dating, but not feeling like these questions should diminish who you are, because I'm sure we've got lived experience of telling someone they're like, can't date you. As a patient advocacy group and a charity, we work with a lot of people living with the condition, and when I heard that for the first time, I was like, okay, let me carry this home. Let me have these conversations with my brother and sister who need to have this conversation elsewhere, you know? But talking about empathy, I want to say as a person that am an empath, it's quite hard to talk to people and understand where they're coming from. And I had to say to myself, for the people in the room that are not living with sickle cell, you don't have to. You just need to make sure that they're aware that you know, and that you're there to support on their grounds. Not how you think you can support, but how they would like you to support. So again, going back, just asking those questions, you know?
There's a question, how does it affect?
Yeah, so what is it like living and managing with sickle cell? How do you live with it?
So I get treatment called exchange transfusion every 6 weeks. That's where I get needles put into me, and through one arm they would draw out blood so that my sickle cell blood levels go down, and through the other arm they would give me blood. And the blood that I receive comes from people who donate blood, and this is why it's important to discuss, and all of us discuss in our own time about blood donation and how much also black people need to donate blood. Only 1% of black people in the UK donate blood, and it's important that myself, my boy Ricky here, Nikki, we was in hospital the other day getting transfusion at the same time, and the blood we get comes from people who generously sign up and go and donate blood. And there's a lack of black donors, so it's very important for black people to donate blood. So at the age of 25, I've got a left hip replacement due to AVN, which is avascular necrosis, and that's a condition caused by not just sickle cell, but when there's a lack of blood flow going to like a part of the body. Mine was the tissue bone in my hip, which caused it to stiffen up, and I was told at the age of about 23 that I had to get a left hip replacement. So I was put on a waiting list for about a year and a bit, and a few days after my 25th birthday, I got a left hip replacement. So that's one of many ways that sickle cell has affected me and affects people in general. So you will hear a few people say that they have had some type of surgery due to their sickle cell. Yeah.
Thank you.
How much blood do you receive?
I received 12 units of blood. I think, if I'm not wrong, that's about 3 litres, if I'm not wrong. Is it 3 litres? I think it's about 3 litres. I could be wrong.
It's 470 per blood donation, 470 millilitres.
Right,
So if you get 6, this might as well make it 5-6 litres.
right.
So that's 12 people.
Yeah, so one person could be saving up to 3 lives donating blood. So I get 12 units, and I was told the other day that you're actually like 12 units is not enough for you,
Yeah,
need to get
no,
15. So
Yeah, because there's sometimes like what your body needs, there isn't enough to go around.
yeah,
So there's times when I've had to have like 8 bags of blood just because there isn't enough. Or I get my exchange every 6 weeks, or the time they've had to push it back because there just isn't enough. So it's just so important for people to like donate, and you do feel the difference. The month when I had 8 bags as opposed to the month when I had 12 bags, I was like in bed half the time. So it does make such a massive difference.
And before, I just want to say, imagine everybody here gave blood today. Just think about like how that immediately affects someone's life.
I think for me, impact-wise, it's kind of a continuation of my last answer in terms of still not sure. So I have another health condition which creates a lot of fatigue, really extreme fatigue. And it's only recently that I'm starting to look at how do these different things interact with each other and compound each other. Prior to, I think quite recently, sickle cell trait was always described as asymptomatic, so it's like, you know, you've got this, but don't worry, it won't affect you. But there's so much anecdotal data from people who have pain and fatigue, so it's really difficult to know, especially when you have other conditions, it's hard to know what is kind of having the impact. I was saying in terms of some of the work I do, I've done a lot of work this year around grief and bereavement, and there can be so much grief around your health. You know, having a month where you can't get out of bed, there's so much loss attached to that, whether it's the energy side of things, income, relationships that are affected. So I see a lot of that in the work I do. I'm really just, I think there's something about the kind of the community elements of it as well, when you see someone struggling, and going back to that empathy side of things, how do you show up for people, how are we showing up for each other? Because something I took away from that first question, which I've heard again and again, is this sense of privacy around it and this sense of secrecy. And a lot of people don't lose that in adulthood. You know, if we're conditioned a certain way as children, you know, keep this quiet, don't talk about it. a lot of people carry that into adulthood as well, and are carrying these massive weights that you can't see. And I think that's one of the challenges generally with invisible conditions. You look at the person, it's like, oh, you know, you look great, your hair looks great, you're smiling, you're laughing, everything must be fine. But you don't know what pain that person might be in, what invisible struggles they're carrying. Another thing I would say as well is just I see the impact of the kind of discrimination side of things as well, whether that's in the workplace, whether that's in the healthcare system. I had to go to hospital earlier this year. I was having particular symptoms, and they looked at my history, and they said because of sickle cell and a couple of other things, the trait, that I had to go in. And I was making conversation with the paramedic, and I said to him, oh, so who are the most difficult patients you get? And I'm thinking, you know, I live in southwest London. I'm thinking he's going to say, oh, Friday nights are the worst, you know, we get all these drunk people. No, he said sickle cell trait patients. And he said this to me, having seen my records. And so it's things like that. It's really challenging those views and those perspectives. And it's very unfortunate that that's coming from someone in the healthcare sector. And it isn't, from what I've heard, anecdotally, it isn't rare.
He says sickle cell trait patients.
No, sickle cell patients. Yeah.
And I guess that's probably because he doesn't consider you as part of the community having the trait, I guess.
Yeah.
Did he explain and say what he meant by that?
Sorry to cut you off. It's actually something that I've heard so many times, and what hurts me the most about it is actually hearing a lot more from black nurses. I remember. Yeah, it's like they see you as a pain. Because I remember there was a friend of mine. She was in hospital, and she was requesting pain relief because basically every time a sickle cell patient requires morphine, they need 2 signatures, and it's like the morphine is not kept on the ward.
So inconvenient.
Yeah. So basically, the more sickle cell patient like a ward gets, they complain because every single time that patient needs pain, you have to go off, get it, come back, get 2 people to sign it, and they just see it as a lot of work. And I remember one of my friends was telling me she was in a crisis and she was looking for a nurse and she couldn't find a nurse, so she hopped off her bed. I went to look for a nurse and she found 2 black nurses talking about her, saying, I can't stand when they put sickle cell patients on my ward. And she said, we all know they're morphine addicts. Like, that's literally how a lot. That's literally how a lot. They just see it as like, and because it's like, you look healthy for the most part. And even I've even had people, like paramedics, trying to reason with me and just be like, oh my gosh, I can tell you're in so much pain. And so a paramedic actually said to me, we know when, you know, most of the people are lying when they're not in pain. And I was in so much pain, I just couldn't even like comprehend like what that meant. Because I just thought, how do you measure someone else's pain? Because physically we don't look it, and that's something that you have to like kind of, it's challenging to deal with like public perspective.
And when it comes to black people in hospital, unfortunately we've had to dumb down our pain and what we're going through.
Just get ignored.
Because firstly, as a black woman, you're already seen as loud in your society. As a black man, I'm seen as a threat. And they will always ask a question in hospital between 1 to 10, what's your pain? And 9 times out of 10 is 20, but we have to kind of dumb it down. So if I really want to show you how much pain I'm in, I'm going to scream this hospital down. Unfortunately, as a black man, I'm going to be seen as a threat now, and I'm going to be seen as a danger and not the actual patient. So I have to dumb down my pain, and I can't show, you can't see on my body or Nikki's body, or if you was to have a sickle cell crisis. So you're kind of having to convince doctors how much pain you're in. And then you're getting called addicts because it's like you're just coming from morph. No, we're not. We're coming because we're in pain. And unfortunately, that's a huge struggle that sickle cell patients go through, having to convince doctors of how much pain we're going through. I'm not sure how many people have heard of the story of Evan Nathan Smith. He was a young person who went to hospital. His parents were going to bury his mum was going to bury her mum in Ghana. He had a sickle cell crisis. He was a teenager, I think. Went to hospital, and they refused to give him oxygen, and he was having a crisis. He told his mum, don't worry, go to Ghana, it's just a usual crisis, I know how what to tell the doctors. They were not giving him no help whatsoever. He ended up dialing 999 for his hospital bed, and unfortunately ended up dying because of the lack of help. And that is it's not new to us as sickle cell patients.
I remember, I think I told you, but that exact story, I remember that day it came out on Twitter, it triggered me because I'd gone through exactly the same thing. And I remember I was in the hospital and I called for pain relief at 7 o'clock in the morning, and they were like really short staffed, and I'm always trying to like think about the nurses and stuff, so I don't even ask for pain when I need it. And I think I was in so much pain I passed out. I woke up in my hospital bed, I think at 11, no nurses still would come to me. And at this time I was like messaging my family and friends like, I don't know what to do. And I think it got to like 3 o'clock. Remember, I've been pressing the buzzer from 7 o'clock in the morning. It got so bad I literally thought like I wasn't gonna make it, and I was so desperate. I went on Google and I googled the hospital reception, main reception, and I called the hospital's main reception. I was like, hi, I'm in this ward and I'm literally like, I'm in so much pain. And when she sent like the security up or whatever, and they came, after it was all sorted, the nurse came up to me and shouted at me for getting her in trouble. And she was like, can't you see I'm short-staffed? And I was thinking, I've been pressing the buzzer from 7 o'clock in the morning, and it's like, you just have to, there's nothing you can do.
And just to add, so working in the office, what's scary is this is two perspectives you get. We get phone calls every day. Can you call this hospital because they're not listening to me? Can you speak to this person because I asked for morphine and they won't give it to me? I used to have this treatment as when I was under the youth provisions. Now I'm an adult, they won't give me this treatment. And it's literally all the time, to the point where it's quite upsetting actually, because you've got these professionals that chose to work in this industry, but they lack care. And it doesn't matter what condition it is. Sometimes the patient is here because they use your service. You wouldn't exist. So let's just call it how it is. NHS wouldn't exist if they didn't have the patients that use their service. So treat these patients equally, regardless of the condition. But when someone knows their condition, like, because it's not something you get at the age of 25, you're born with it. When someone has lived through this experience most of their life, and they come into hospital knowing what care helps them best, please just respond. Because we know how we get when we're in pain. We get agitated. Imagine pain being so immense, it's treated with morphine. You imagine how your agitation is on level 1000. So you're going to be angry, you're going to be upset. You just need to be heard. And I think that's the main thing. These healthcare professionals who are in the world of healthcare need to really care. But I'm going to bring it back to you. Do you think that these professionals know enough about sickle cell? Or do you think they're just lacking care entirely?
Great question. I know a few people now that are nurses, and what they've told me is in their nursing training, they get like these kind of booklets and stuff like that they have to go through. Sickle cell is literally only one paragraph in the whole book. And you will get this in places like Whitechapel's, Mount Hospital, Whips Cross Hospitals, East London, you've got Queens, all these places where there's predominantly black and Asian people in the community. Sickle cell should be pages and pages and training of research and what they need to learn about sickle cell. Unfortunately, it's only one paragraph, so there isn't enough. Some of the work that we need to do is, so just a quick short story. There's a guy that I saw, this was during COVID time, he got arrested, he got stopped by the police and they searched his car, and he said, I'm going, like, you wrongfully stopped me and searched my car for no reason. One day I'm going to come into your office and I'm going to teach policemen how to treat black people.
Say something.
Do you remember?
Say something from Mentivity.
Yeah. So he eventually saw that clip, and he was in the police place wherever they do their training, and he was teaching them how to approach black people. I think we need the same with sickle cell patients. We need to be in the places where doctors and nurses are being trained to speak about our experience and to tell them, this is how we feel when you do this. This is how you should approach someone who has sickle cell. This is the most growing genetic disease in the UK. This is the kind of pain we go through. I don't see much people that have this kind of pain that have to have morphine come in hospital every day more than sickle cell patients. So these are the kind of places we need to go to talk about experience so that they know what we're going through.
I was going to say off the back of that, I'm not trying to be a devil's advocate, but I think another issue that I see with, especially with like healthcare, is they just do not have the capacity. The nurses that do have the compassion, that do care for their nurses, they're overworked, underpaid, and as sad as it is, like, is the patients that end up suffering because of the patients that's with them on the ground, like every day, like feeling that. So I think that's another issue that needs to be addressed. If these nurses are not being appreciated in their workplaces, because I've met nurses that they're literally killing their backs, they're not having breaks, and even going above and beyond, they still don't have the capacity to be there for every patient. And it's just, even the ones that do know, so I don't know, there's like a systematic, what's that word? That word. Error somewhere as well. And I think once that's addressed as well, it can like take the relief off of them to do their jobs properly. Because sometimes it's just, there's only so much that they can do. And even as a patient, sometimes I feel for them, or as they treated me, or they come back from break, there's like another 4 patients waiting, and like they're human beings as well. So I always try and have that compassion for them as well, doing their jobs. It's really tricky.
I used to work at a medical school, and the dean, the kind of man who ran the school, I remember him giving a talk to new students, and he said to them, patients are people, they are not hosts of interesting diseases, they deserve dignity, they deserve humanity. And on the one hand it was a really powerful speech, but on the other hand it's, do we really need to tell people this? Do we really need to point out people's basic humanity? And that's for the general population. We're not even bringing in sickle cell patients or talking about medical racism or these other intricacies. So if students need to be told that, are they being told that consistently? Compassion fatigue is a massive thing. You know, I work with different professionals who have to work with trauma. And working in these environments can be very traumatic. If you're around people who are in pain every day, who are suffering, and there's only so much you can trauma, and there is no support. But like you said, it's systemic. If the nurses are working 12-hour shifts or whatever, and plus they're burnt out from dealing with all of the pain, they've got their own problems at home, then it's, you know, the healthcare system, we know it's not in the best place right now, but equally, I love, and I know, having been an inpatient in hospital myself, I do have that compassion for the nurses, but also, very selfishly, I don't want to be in pain, I don't want to be sick and have to worry about you. I'm not here to care for you, I should be receiving care. And so I think, as well, there's that element of, I feel like, even in those dark situations, there's still that burden as well. I really need this pain relief, but I can see the person's tired. We shouldn't have to, we should be able to demand what we need in those moments.
Thank you. I want to ask, go ahead, sorry, did you want to?
So, I wanted to run away from because I actually didn't answer the last question, because when I talk about this, I actually get emotional, and I could like see myself getting emotional, but I just felt like I had to say it. Just speaking off the back of that, I think a lot of the times you get this kind of treatment from outsiders, but I think with everything it starts from home. It's more painful when it's from family and friends, because you can make excuses for people when they're ignorant, or like a doctor or a nurse or whatever if they don't know it, but when it's people that kind of you expect to know these things, it hurts. And I think when you said how is it affected kind of like living with sickle cell, I think one of the things is like getting used to being misunderstood by kind of everyone around you, because everyone has a certain look of how someone that's disabled should look. So I'm kind of like a bubbly person. I feel like most of the time I kind of get punished for that on the days where I'm sick, because sometimes people will just kind of label it as like, oh, she's sometime-ish, or like, oh, she was bubbly yesterday, why isn't she bubbly today? I remember there was a time I was at home, pandemic, and I was really going through it with my health. And one of my cousins FaceTimed me at like 11 a.m. and he FaceTimed me and I was in bed, and he was like, oh my God, you're so lazy. How can you be in bed at this time? And those are comments that you have to get used to saying. People say a lot of throwaway comments, but he had no idea the reality is I've actually been probably taking morphine like every 2 hours from like 11 p.m. the night before. I hadn't slept. I literally physically couldn't get out of bed. But people don't see that. They just kind of judge everything on like face value. I always say kind of the point of views of me from strangers. People that don't know me see me as like this crazy ambitious person. I've done so much. I'm a go-getter. Where a lot of people closest to me have actually kind of labelled me as lazy because I'm anemic, or when I'm at home, I'm in bed all the time. My sofa does not see me. I have to be like whatever. I'm like laying down, and that's kind of how I function. And people, because they just don't understand, or because they see you first before your condition, which sometimes is a good thing, but sometimes you need to understand the person's condition so you can see them. Because if you're just seeing the person, you're never going to see how they're suffering. But yeah, I feel like I needed to say that.
And it was needed. Thank you. You only have a little bit of time, but I wanted to kind of add, your story is more important than the feelings of the medical professionals that will be dealing with you. Don't get me wrong. Medical professionals are going through it like crazy. I have family on both sides that go through it at the NHS. But for them, it's, okay, you're a little bit tired. For you, this is life or death. And I want to say to you three especially, your family, and everyone here, we often sometimes minimize ourselves to make other people happy or to make sure we don't make that much noise. For you three especially, make as much blood clot noise as you can. And for everyone else, if you are ill, take a sick day. If you have a bereavement, take a sick day. These things are enshrined in law to make sure we are protected and supported. Right? White people are doing it. Wendy gets the sniffles one time. She's on sick leave. We need to do the same thing. I mean, it starts with self-love and self-care.
Can I say something to that? I definitely think this is where we can all be supportive towards each other as well, because I am very assertive, I can advocate for myself, and certain experiences I've had with the healthcare system in relation to another chronic illness have left me so just empty, just really depleted me. And recently I've had experiences where silly little things where I've very easily got a referral for something, and it's left me crying, not because, oh, this is such a horrible experience, but this person's being really nice to me, and in the past no one's listened. I've had to wait how many years or how many, go through how many hurdles, had to really prove and do the most that I need this. And I think there's people we look to as ambitious, as strong, as whatever, but actually just Joshua's words right there, just those reminders that you deserve to have good healthcare, you deserve to be listened to. This isn't, special that this person's taking the time to hear you and is making a referral or is giving you the pain meds. These are the things we should have all the time, but I don't know if you've heard of the term breadcrumbing, when someone gives you like breadcrumbs, the bare minimum, and then you start to really appreciate, I've got these breadcrumbs, but you never get the full loaf. We deserve to have the full loaf or whatever the equivalent is in terms of our health and well-being, but our expectations get managed down and down and down, and then we do kind of feel like, they're doing this little thing, lucky me, but no. We should expect more, and I think that's a key area where we can all support each other to kind of give each other those reminders, because even with the strongest person, even with the most resilient person, we need to hear these messages, we need these reminders.
Thank you. I want to kind of wrap this up. We've got 3 minutes left, but I really want to kind of ask you one final question in a kind of like deep, because everybody here comes from a different sector, right? HR, NHS, people here that work in the media, people who work in government. So how can we influence policy around sickle cell, apart from voting out the Tories, of course? So how can we influence policy and change the stigma of sickle cell within society and to get rid of those systematic barriers?
First and most importantly, advocating what we're doing here today. Being heard comes from talking about. You can't be heard if you're not talking. So you really need to advocate, even people that don't live with the experience. I mean, it took a lot for me to get here tonight, but I had to be here. Most importantly, because the work I do is very, very important. So I'm quite proud of this. At the ACLT, the African Caribbean Leukemia Trust, we change policy by being heard. Unfortunately for us, our CEO, Oren Lewis, OBE, he's been doing so. Yeah, so he is part of parliamentary groups which exist, which you can become members on and go and add your personal experiences, whether lived experience or not. The personal experience is better than nothing. So yeah, join parliamentary groups and be heard and advocate, not if you live with it, not just if you live with it, but also if you know people that live with it. Share that experience. Be the biggest cheerleaders and supporters.
I think that's great that we have that on that side, but also having that work and community work as well. So groundwork, which is something that I personally do, so workshops in schools, prisons, places of worship, corporate organisations, where I tell people about sickle cell, but also something that India are doing. The top 3 countries that have sickle cell, Democratic Republic of Congo, is where I'm from, Nigeria and India. Something that India are planning to do is eradicate sickle cell from their country in years to come. One of the things ways they're planning on doing that is family planning. So I don't know how that would work in the UK. Yeah. So we've got it. One thing we need to do is have a conversation about telling people about their genotype, having a conversation about their genotype, and that's very important. Our parents didn't have that conversation. My dad has a trait, and mom has sickle cell. In the 80s, they definitely weren't having that conversation as much as they are now. Hence why a lot of us are here today. But I feel like if we have that conversation to tell people what should you get with, have the conversation about a genotype before you get married or before you plan on having children, whatever. If we continue that and tell our children about it, they tell their children about it, in generations to come there could be a big fall of, the amount of people who have sickle cell. I believe that.
Let me just add to that. So just quickly, I know we're conscious of time. Don't just have those conversations with African Caribbean people. Yeah. I'm working with Hammersmith and Fulham Council. There's 159 sickle cell patients living in the borough. 18 of those are white. Yeah, so don't just have those conversations with people that are black. It's far removed, but there is treatment options for planning a family. So we don't want to eradicate people that are already here because they're a blessing. But 300 babies approximately are born each year. So if we can reduce the number of those born with living with the condition, it would help.
I think as well as having the conversations, I think it's so important for a safe space to be created for people to ask questions. Because I think when I have conversations with people that don't have sickle cell, that's one thing I hear the most. Like, people feel uncomfortable to ask questions because they think they're overstepping. But I think if we make it such a natural conversation, things that we just speak about, there's nothing awkward about it, about being educated on something. And then that kind of cancels out all the misconceptions. I think the misconceptions about sickle cell sometimes are so dangerous. And even ignorant things, when people will say things like, you don't look like you have sickle cell, like what does that look like? Do you know what I mean? There isn't one image, and I think that exactly all of that kind of stuff, and I think it's so dangerous. So I think just to create that a space that people can just ask questions, so we can talk about, have more conversations, and it's just it's a natural thing that's just part of a day of life.
I would say rather than influencing policy, just kind of influencing change more generally, it is those conversations, normalising these discussions, raising awareness. If there's anything you've learned tonight from different experiences or what you go on to hear, sharing that with others, donating blood. Sometimes when it comes to things like changing policy, it feels so big, it feels so just out of our control, but each of us has our sphere of influence, whether that's the people we know, the things we can do. So I would say maybe just come away from today, if there's one action you can take, then that will surely make a big difference.
Sorry, do you?
No.
No, listen, it's your panel, not mine. So I just want to thank you. We've just come to time, but these amazing experiences that you wouldn't have had otherwise. Join your parliamentary group, do grassroots roots, have the conversations, create those safe spaces. I want to have a massive round of applause from everyone. Thank you very much.
Hello everybody. The microphone's dead, so I'm going to have to speak a little bit louder. We're going to be now starting our next session. I'm not going to say any more, but we're going to have the lovely Alexia that's going to be talking to us about Anthony Nolan. So.
I'll do my best projecting.
Microphone as well.
Is this one? Oh, whew, okay. We'll try this one. Hello, perfect. Okay, so thank you so much for inviting us as an organisation this evening. We're really, really grateful to be included in this space. I am going to introduce to you Anthony Nolan. I want to ask how many people have heard of it, but don't want to upset myself, so I'm not going to ask. But hopefully by the end of this, you will know who we are, what we do, why we exist, and how you can help us, really. So, no pressure. I've got a remote, I've got everything. Thanks so much. Would you want to be in charge of it? Thank you. So, Anthony Nolan is the charity saving the lives of people with blood cancer and blood disorders. We do that by making life-saving connections between patients who need stem cell transplants and amazing strangers who are willing to donate their stem cells to give them a second chance at life. So we were founded in 1974 by an incredible woman called Shirley Nolan. Her son Anthony had a terrible blood disorder and he desperately needed a stem cell transplant to cure it. At that point, there was no such thing as a stem cell register. It didn't exist yet. So if you didn't have a familial match, then unfortunately, the game was up for you. So Shirley went on, she campaigned, she went to Parliament, she went on the news, she wrote letters, she just went crazy spreading the word to start the world's first stem cell register to give her little boy a second chance of life. Unfortunately, we didn't find a stem cell match in time for Anthony, and he died when he was 7 years old. But over the past 49 years, Shirley's mission has never ever faltered. We've grown as an organisation from strength to strength, and now we're much more than just a register. So in 1996, we opened our Anthony Nolan Research Institute, which is dedicated to improving patient outcomes. We have a cord blood programme that we started in 2008, which supports people who need matches that we can't find matches for on the register. We then launched our patient services programme, and you're going to hear a bit more about that a bit later on. And now, in 2018, we started our cell and gene therapy service, and that is one of our main focuses today. So throughout all of this, we've remained really committed to saving lives, and every day we give 3 people a second chance at life. We're building on our 50 years of experience and expertise to keep pushing the boundaries of what we can achieve, for our patients. So, why we're needed. So, blood cancer is more common than most people think. So about 40,000 people in the UK are diagnosed with a blood cancer every single year. A stem cell transplant is often their best chance of survival, and around 2,200 people start their search annually. So unfortunately, there isn't always a match on the register for all of these people, and some will pass away waiting to find one. And even those who do end up having a transplant, it is no easy feat. It's a really, really long and difficult recovery. So last year, we were able to give 1,350 patients a second chance at life through a stem cell transplant. But the reality is we can't help everybody who needs one, but we won't rest until we can. So I'm going to talk to you a tiny bit about sickle cell and stem cells, because there are many people in this room who know much more than me. But I'm going to touch a little bit on kind of the science of it and why we're talking about it, Anthony Nolan. So a stem cell transplant can be curative for sickle cell disease. However, it isn't a viable treatment option for everybody. Tonight, you are going to hear the stories of 2 incredible women who both had stem cell transplants to cure their sickle cell. And it has only been a treatment option since 2020, so it's really, really recent in this country. It's currently an option for those under the age of 18, not everybody, but they do offer it. However, as an adult, an unrelated donor matched transplant isn't an option in this country. It is in other countries, so I don't want to say it will never be an option in this country, but as of right now, it isn't, unfortunately, an option. Research is happening, and we learn more and more every day to continue to improve the treatments and different therapies for patients. So, we're going to watch a little video, which is a bit of a cartoon, but it's a really, really kind of simple way of looking at what would happen if you joined the stem cell register, which we would love for you to do, and came up as a match. So I'm hoping this works and it has sound.
Anthony Nolan saves the lives of people with blood cancer. If you're on the Anthony Nolan stem cell register and you come up as a match, this is what would happen next. When someone, anywhere in the world, needs a stem cell transplant, we search our register of brilliant potential donors. If you're a match, we'll get in touch. We'll ask you to go to your local doctors or hospital to give a blood sample, which you send back to us for further tests, to make sure you're the best possible match for the patient. Once we're sure you're a match, we'll let you know the exciting news and we'll chat on the phone about the details of donating. Next up, we'll give you a full health checkup to make sure you're in tip-top shape. We'll pay for all your transport to one of our specialist hospitals, where you'll also go to donate. About a week later, we'll give you the go-ahead if everything looks fine, and make arrangements for your donation, including booking all your travel and a hotel. For 90% of people, they will donate via peripheral blood stem cell collection, or PBSC, where stem cells are collected from your bloodstream. For 4 days, a nurse will come to you, at home or work, and give you a course of injections that stimulate your body to produce stem cells. You'll probably start to feel a bit achy. That's as the stem cells emerge from your bone marrow and flood your bloodstream. They work to help your body repair, so they're completely natural. On the 4th day, you and your companion will travel to the hotel to put your feet up for the night. The next morning, you'll go to our specialist hospital and your donation will begin. You're connected to a PBSC machine, which takes blood out of one arm, filters the stem cells out, and then returns the blood to your other arm. This takes about 4 to 5 hours, and you can't move too much, so bring a pal who's good to chat to and a box set to get through. When you've finished, your bag of stem cells is taken to a lab to check the count, and if they're enough, you can head home. If we haven't collected quite enough, then you'll need to pop back the next day for another session on the machine. After your donation, you'll probably feel a bit tired, but this passes after a few days. For 10% of people, they donate via their bone marrow. This is because it's sometimes better for the patient, which is why we make sure when you sign up to the register, you're happy to donate via both methods. You travel to our specialist hospital with your companion, where you'll stay for the night whilst your pal goes to a hotel. The next morning, you'll have a general anesthetic and a short procedure where bone marrow is taken from your pelvis using a needle and syringe. When you wake up, you'll have 2 plasters and feel a bit bruised in the areas where the bone marrow was taken from. You'll also feel tired after the anesthetic for the next few days. You might want to take some paracetamol and rest, and you'll spend the day and one more night in the hospital recovering. Whichever method you donate by, someone from Anthony Nolan will come to say a huge thank you and give you a goodie bag just to make sure you know you're doing an amazing thing. After you've donated, your stem cells will be taken to the waiting patient who's had their immune system wiped out in preparation for the donation. They need your stem cells to kickstart their immune system into action and help begin their recovery. Your body replaces your donated stem cells quickly, and you will have given someone a second chance at life. You can help save the lives of people with blood cancer, and we think that's incredible.
Okay, so I know that was like a bit of a cartoon and a little bit unserious, but actually it is really serious. Those donors that go through that process give people a second chance at life and ultimately go on to save lives. So we make a light of it a little bit, but it's a really amazing, and we're incredibly grateful. So there is an opportunity for those of you who wish to sign up to the Stem Cell Register this evening. You can also just come and speak to me. You are under no obligation to do anything. Sabrina is also equally incredibly knowledgeable about this, so go and speak to her too. But yeah, there's a couple of facts about the Anthony Nolan Register. So to join the Anthony Nolan register, you've got to be aged between 16 and 30. So we know from research that younger donors provide better outcomes for patients. So what we've decided to do as an organisation is really focus our efforts into that really small window where we know the majority of the donations come from. So if you do choose to sign up, there is only about a 1 in 800 chance that you'll come up as a match. So it isn't like giving blood where you sign up and you go and you do it. It might just be that you may come up as a match. If you are a young man between the ages of 16 to 23, those odds increase to 1 in 200. So young men make better donors than women, unfortunately, sorry. There's a lot of different reasons. Men just tend to have a better yield of stem cells, and also they're more available. There are times in a woman's life where she isn't able to donate, like when she's pregnant or breastfeeding or 6 months after birth. So yeah, men are better at this thing. The next thing is, even though we only sign up between 16 and 30, you will stay on that register till you are 61. So you are searchable for patients up until you are 61 years old, unless you tell us otherwise, unless you say we don't want to be on this list anymore. We will need you to be living in the UK for the next 3 years, if you are planning on leaving this lovely sunny country. You can always sign up to the register in whatever country you're going to reside in. Lots of different countries around the world have lots of different registers, and when we are searching for somebody, we will search all of those registers. Yeah, we're not separate, we're not divided, we all sit under the World Marrow Donor Association, and we all share our magical lists of magical people. And yeah, the 2 methods of donation were talked about a little bit in those videos, but you have to be willing to donate via either method to sign up. So the method of donation is dictated by the patient. So all that will happen is a transplant centre will get in touch with us and they'll say, we need a donor and we need them to donate via bone marrow, or we need them to donate via peripheral blood stem cell collection. That can sometimes be decided by what illness the patient has or the age of the patient. Quite often babies require bone marrow instead of stem cells, and there will be scientific reasons for that, I don't know. But yeah, PBSC is just like giving blood, really. It just lasts a bit longer. It's about 4 or 5 hours, sit and watch Netflix, pretty chill. People say they feel a little bit like they've got a cold for about a week afterwards. Bone marrow, a little bit more serious, under general anaesthetic, 2 nights in hospital, but people have likened it to a hard leg day at the gym, like afterwards. So yeah, if you got the gym, up to you to decide. So, the very important facts. Thank you very much. Oh, it's not working. Thanks. So, just to really emphasise what I'm saying, we're going to watch Doug's donor diary, who actually is speaking to us whilst donating stem cells, just to really prove that it's good.
About Nolan while I was at university, I think they kind of got rid of the myths that donating bone marrow can be very painful. So me and my friend signed up. I think at first I was a little bit nervous, but then also very excited that I could help somebody else by spending very little of my time, change somebody's life in a very big way. I think there is this thing that a lot of people think that donation does hurt. I didn't find any of the process painful at all. I had a few blood tests taken, and I've had these needles put in me, but it's just like having any blood test at your doctor's or having any injection done before you go on a travel holiday. So I don't think it's painful at all. And a little bit of pain, I think it's okay for, the chance of saving somebody's life. I think it's amazing that I get to sit here and donate something for myself, and how that could potentially save a life. And when you think about saving a life, it's not just that life that is important, it's just like the friends and family that's also associated with that life. And you might be saving one person, but you're helping a whole family or community and friends as well. I mean, cancer is something that can affect anybody at any point in their life. And I think what got me sign up was the fact that if it happened to me or my friends and family, I'd want there to be a better chance of them surviving. I'm really proud to be a donor. I told my friends and family about this. My mom's really proud. My girlfriend was extremely proud. She's gone around and told everybody. And I mean, it's just nice knowing that what I'm doing here could help save a life. And I don't think there's a price on something like that.
Thank you so much for giving me the time to speak to you all this evening. I'm going to be around for the rest of the night if you have any questions at all. But as Doug said, please go and tell everybody. Go and tell everybody you know. I would put my hand in the fire and say everybody, maybe except Sabrina, in this room has learned something from that presentation this evening. There are a lot of myths and misconceptions around donating stem cells and bone marrow, and people are terrified. They have this real view of like this giant needle that goes in your hip and being tied to a table, and it's not like that at all. We've moved on. So yeah, if you know people of the ages of 16 to 30 who are in general good health, let them know that we exist. Tell them to do a bit of reading, and yeah, we hope to see them on the register. Thank you so much. Thanks.
Thank you. So, also, by the way, I am Anthony Nolan. I've been on this for many years. Not been called yet. I'm waiting. Feels like the Avengers. I'm like, come on, I'm ready.
Me too.
Take my blood.
I'm like so disappointed.
One day.
One day.
But next, I want to bring the amazing the ACLT charity.
Sabrina needs this, doesn't she?
Myself,
Sabrina.
also the amazing work that they're doing. I want to keep talking about, but no.
Should I do talk?
Sorry,
Yeah.
Sabrina, can you put this on? What's that for? It's for the live stream. For the live stream.
Cool. I'm going to stand up. You're going to do clicker?
I can do clicker.
Can we just make the volume about 20? I'm going to play some bashment. No, I'm joking. So I'm Sabrina. I am a lifesaver in waiting. And I'm also a blood donor. And take my organs when I'm gone, because I ain't going to need them, right? But most importantly, I'm an advocate for the ACLT. I'm also an employee of. And interestingly, I left a career in banking that I had for 13 years to just save lives, because you never do something well unless you're passionate about it. And I hope that translates to you today. Like, let's just get some passion in a room and just create some change, be disruptors and also avengers. So I've got a quote on the board, and it says, we're the ancestors of the future, and what we do now will have an impact, ultimately. Good choices, bad choices. Anything we do will have an impact. Rosa Parks on a bus never knew she would make history, but she has. And we all stand here or sit here today and create change, be disruptors. So just remember that quote. I love it. Next slide, please. So the ACLT, these lovely people on the board, Beverly DeGale, OBE, and Oren Lewis, OBE. I don't just speak so fondly of them because I work with them. I see what they do. Because unlike other companies, my CEO and director of operations, the co-founders that founded the work that we do, the tremendous work that we do, are in the office with me every day, working away. And trust me, we've been busy. So, and I admire them for that strength. They look good, innit? You couldn't tell that they work hard. They look good. But it was founded, and we have been going for 27 years, but that come at a cost. Their son, Daniel DeGale, was diagnosed with blood cancer, leukemia, at the age of 6. And it just hurts my soul. There is a form of leukemia, acute lymphoblastic leukemia, that's more common in children under the age of 15. But also, blood cancer affects people. Every 14 minutes, actually, someone's diagnosed. So we are award-winning. We do good, I must say. But most importantly, we can't do the work without the people that we advocate for, not only for Daniel, but for others. So, next slide, please. Daniel was one in a kind, pretty boy. He had girlfriends, I'm going to say that, had girlfriends, many girlfriends. They still come up to us today as Daniel's girlfriend. I wasn't, by the way. But Daniel, 6 years old, blood cancer, leukemia. Misconception is that leukemia isn't a cancer, it is. Daniel went through 2 courses of chemotherapy, and after relapsing twice, relapsing means when the cancer cells come back, he had a 25% chance of survival. So Bev, Orin and Daniel went to see a consultant at Great Ormond Street, and he was told, there's this revolutionary treatment that Daniel can have, a bone marrow transplant, or what we like to call today a stem cell transplant. But because he is black, which we never think we should hear, right? He has a 1 in 250,000 chance. Let me say that again. 1 in 250,000 chance of him finding an unrelated donor to match him and provide him with a stem cell transplant. If he was white, would have been 1 in 5. Easy. 1 in 5. So tell me how our ethnicity should affect our chances of survival. And at that point, there's 2 things. There was only 500 to 600 people on the Anthony Nolan stem cell register. 500 to 600 black people in the UK on the Anthony Nolan stem cell register. So we had to recruit. We had to raise awareness because there's a lot of misconceptions. You can literally save someone's life. Why are you not doing it? But I guess for some people, it's just hearing about it. These conversations, they have to start somewhere. But also of African heritage, we are the largest gene pool in the world, most diverse gene pool. And you can just tell North Africa, South Africa, people look different. And that just goes into, genetics. But more can be done. So Daniel did win the lottery. He did. He found his match. Odds against him. And he found his match in a donor across the ocean in America. And she gave him the gift of life. She gave him the opportunity to do 12 GCSEs, 3 A-levels, and start studying sports physiotherapy at university. But he waited 6 years to find Doreen Carney. And I believe if he hadn't waited 6 years and that donor was there ready for him, he would still be here. Probably be here, doing this conversation himself. We shouldn't need to wait. We shouldn't have our ethnicity play against our odds. And most importantly, as treatment changes for those living with sickle cell and bone marrow or stem cell transplants become an option, because it does happen in other parts of the world, India and America, just to name 2, we need people that can match them. We don't need to play a gamble. And it is a numbers game. The more people registered, the more people have the option to match. So not only do we raise awareness, like having conversations here, if we move on to the next slide, sorry, how long have I got? We also support patients from diagnosis throughout treatment. Sadly, sometimes we have to support their family and friends when we have lost a life. And sometimes we get to celebrate. So I'm going to share something with you that I shouldn't be sharing, but I'm going to anyway, because that's how we roll. And we do, like I was just explaining, so although we support patients in need of stem cell, blood and organ transplants as a blood cancer and blood disorder charity, there's people in this. And what's great about the work I do is I get to have fun with these people because they shouldn't have limited beliefs or limited lives. And so I took someone across to Banksy exhibition only on Sunday because she told me at 18 she went back to sixth form after having a summer break and her spleen removed, because that's another issue when you're living with the condition, you may have to have your spleen removed. And she went back to sixth form and she was like, everyone's talking about how they live their life. And I've gone back and I've not done nothing. So I said, cool, we're going to start living then, aren't we? What do you study? Art, Banksy's on, let's go. So we're embedded, we're in the culture, we're with these people, we walk with them, So you may recognize, well, actually, we're campaigning for some, and one's in there. I've got some good news to share, but next slide, please. Stem cells, boring stuff, but they're revolutionary. Bone marrow, the marrow in the bone, produces stem cells. Stem cells produce our blood cells. So a nice link. When you have sickle cell, your red blood cells are affected. If you have a stem cell transplant, it gives you the stuff that makes new blood cells. 2 + 2 = 4, right? Yeah? I won't bore you with that. Let's move on. But by donating, this is what happens. This is what you get. Let's see if I've got the slides right. You get people like Brenda who lives. Because Brenda's got cutaneous T-cell lymphoma, and she hasn't been able to find a match for 4 years. We might have good news to share on Friday for campaigning and raising awareness to give Brenda a second chance of life. And this is what it does for a family and community, brothers, sisters, mothers, and the person at the end of this when they receive this revolutionary treatment.
They knew it would be an emotional roller coaster, a meeting they'd been dreaming of for 5 long years. They travelled 4,000 miles and into a different time zone for their first face-to-face encounter with Doreen Carney. The tense atmosphere as they waited was excruciating. So it now really is just a case of waiting. The family in the room just behind me, their emotions have been geared to this moment when Daniel meets the woman who gave him the gift of life for so long. And that meeting really is now just literally moments away.
My mind's blank, it's just anxiety now, just trying to pass time, wait for what's going to happen.
I'm so excited. And on Chase and Leah, I didn't think I would be like that, but the closer it gets, the more excited I am. I can hug them, right? Okay.
I'm a very serious person, but you make me smile so much because it.
You mean a love hug? Huh? I'm really so tired.
I feel like we've known each other for ages already, like we've known each other before, talked a lot, but now on visual it's just it's completely out of this world.
Still to this day, that video gets me. But I don't think we'll act without emotion. So Doreen Carney was Daniel's gift. She gifted him life. 9 more years of all those girlfriends. But something that wasn't promised with a 25% survival rate. So you can be a Doreen or you can be a Femi. And I love this guy. Honestly. Femi, he's revolutionary, just like the treatment that he did, the donation that he did. So the pink bag is stem cells. The yellow bag isn't urine, it's actually plasma, but okay. We do a lot of work in schools and sixth forms, and they always like, oh, you donated, no. It's actually plasma. So it's also life-saving. But this is Femi on the 18th of October, this year, donating stem cells. He's actually donated 3 times. So last year, he donated bone marrow, and he said, gosh, Sabrina, it just felt like a rugby match. Is this all it was? I could do that over again. Because he knew that by donating bone marrow in this circumstance, he was donating to a child of African heritage who was living with something that can take their life. Sign me up. Where do I do it? I'll do it again. He then had to donate lymphocytes. Well, he didn't have to because it's a voluntary process. But in his head, he had to because it's a child or a person that is granted life and just wants more of it. Donated lymphocytes of white blood cells. And then this is him on the 18th of October this year donating stem cells. So he is an ultimate donor. That very rarely happens. I'm just going to make this clear. It's very rare that you even get called up. So I'm of mixed heritage. And so I've got Italian, German, St. Lucian, French, English. So I asked Auntie Nolan when I started this job, I said, I've been signed up since I was 19. I just want to donate. Please let me donate. They're like, Sabrina, don't work like that. You've got to match someone. So I said, tell me, who do I match? 41 million people on the stem cell register in the world. Auntie Nolan have secured a hell of a lot. 1 million, right? Almost 1 million. We'll call it 1 million. But that's not actually enough for the world population. And I said, Auntie Nolan, tell me, who would I match? Thinking, there's not enough people, right? Show of hands if you think more than 5. More than 2? You said 2. Oh, I'll be dreaming. Because actually no one. On this register, at that current time, which is last year, there would be no one that matches me. So if I had blood cancer or blood disorder, I'll be pretty much screwed. So the first thing I did was call my sister, who is in Australia, and I said, join. And she did, through the Australian Blood Service. But she only has a 25% chance of matching me. So when we talk about our sickle cell warriors who need bone marrow transplants and can currently get it from related donors, there's a limited chance of matching, and we can add efforts by becoming registered. So when they're in need and access to treatments from unrelated donors, guess what? There's people there waiting. Can we make that happen? Yeah? Yeah.
So 25% chance of matching
Your sibling.
a sibling. And then if it does match, 25% of success.
Well, no. The success is different for everyone. Depends on how the condition is affecting you. But we won't talk about success because we like to hope that every transplant is as successful. And people in this room do a great job of making sure. But there have been chances where it's not, well, you'll hear the lived experience anyway. But just know that you're not 100% matched to your sibling, even if it's a twin. Identical twins more so, but even if it's a twin, it's not 100%. So we need other people to do more. Swab some cheeks. I've got a saying, sign some sheets, swab some cheeks and save some lives. You may never go on to donate, but by swabbing your cheeks, don't put it up your nose, by swabbing your cheeks, you go on this world register and you can support anyone in this world who is living with the condition that you may happen to match. Because we believe no one should die waiting for a donor to become available. And I just want to touch, next slide, on...
Actually a living beneficiary of what happens when somebody signs up and actually goes through with the process. And I feel like, why is everyone not on it? You know? Obviously there's reasons and there's layers and all that sort of stuff, but in the simplest form, why is everyone not on the register to be a potential lifesaver?
In the simplest form, we understand there's lack of trust in healthcare. We understand there's fear of needles. We understand there are layers and complexities. But in the simplest form, just swab some cheeks, join the register, because Karen Akato, who you saw there, is in her 30s and actually was diagnosed with blood cancer and received a transplant. Helena, who was sat next to her, donated to her dad at 19. 19. She looks well, she's fine. They're not going to clone you. Doesn't happen. Okay? So let's overcome all these myths and misconceptions and just save some lives in the simplest form. Let's just register. And sickle cell, I don't like the term disease, so I use the term disorder because it's not contagious. It is hereditary. It does affect more people than we realize. That number of 15,000 is actually increased. And most importantly, we can have an input into how their life is, especially if they receive blood. Because I said earlier, I'm a blood donor, regular blood donor. I'm B positive, so that doesn't tend to support many people. But if I was RO, blood subgroup, I know it's more than likely going to help those living with sickle cell disorder. Actually, 65% of sickle cell warriors have RO subtype. And if you're African Caribbean, you're 10 times more likely to have that subgroup. So we can all play a part by donating. So once you swab your cheeks, tick a box to become a blood donor. Because people like Maya, or people here today, will receive blood regularly, and it is the difference. So what it does, and I'll just explain exchanges, when you have sickle cell, you have a percentage of sickled cells. By exchanging your blood is reducing that percentage of sickle cells. And it's actually the higher percentage of sickle cells can lead to more, well, with triggers as well, but lead to chances of crisis. Crisis being when they interlock and get blocked and creates immense pain. So by refreshing the blood, like the bone marrow does, or like an exchange, a blood exchange, it can give that person literally an extra step in their day. That opportunity to go to college or that opportunity to go to work and not feel as much fatigue or pain. And we can have an opportunity in contributing to that. But not only to sickle cell patients, to also people, we know black women lose a lot of blood with childbirth. We've got cancer patients, and we've also people with regular surgeries that will need blood. So me being B positive, it doesn't shun me down. I just know someone may need it one day. And I heard something. I'm going to leave on this note because I'm talking a lot. I hope it's all very valuable. You know one thing, when we're going to hospital, because I'm sure we've all used the NHS services, right? It's free. One thing we don't take when we're packing our bags to go to hospital, I got my charger, I got my book, headphones, snacks, because you never want to be waiting for snacks. We never pack blood. Never. You know why? Because we just expect it to be there. But how do we expect it to be there if we don't give it? And so, I hope you leave with this lasting impression. We are the ancestors of the future. And what we do now will have an impact, not only on our lives, but others' lives too. And we can make choices, informed choices, and contribute to those impacts. So let's not leave today with nothing but making an impact. Thank you.
All I can think of is like, imagine someone has a drill and they're just drilling it on your knee, on your joints, and yeah, that's literally just, and it's like it's not surface, it's like very deep in the bone, and I think sometimes like literally makes you just want to like pull it out and just try and get to it when you can't kind of the pain relief isn't working. That's probably that's how I would describe my pain. And you have crisis pains that put you in hospital. So there's a crisis pain where I could have, and I'll call an ambulance. And then I also have like a background pain. And I always say like that one is, it's like having a hum in the back of and it's just always present. So it's like, sometimes when people say to me, oh, you need to let me know when you're in pain, I always say it'd probably be easier to let you know when I'm not. Because like 90% of the time I am in pain. You learn the pain just exists with everything you're doing, you just get on with it. And then like the big painful ones when you have to kind of go into hospital, those are different. But yeah, those are the two different types of level for me anyways, personally.
Just we're going to hear more about the pain, but I wanted to elaborate on the interlocking that I said. So red blood cells, I've got an analogy. So imagine a donut, circular, squidgy, flexible. Sickled cells are crescent shaped, or actually shaped like a sickle, it is a thing. Imagine a banana, inflexible. So as these travel through your bloodstreams, they can get locked because they're not as flexible. And it isn't always where the pain happens. So if they get locked in your thigh, you don't generally have pain in your thigh. You can, but maybe in areas surrounding, like you were saying with the chest. But what's important is that blood takes oxygen to our most vital organs, even to the blood vessels behind our eyes. And if it's getting interlocked, it's not travelling there. And so that's why sometimes in the chest or other vital organs, and a reason why strokes can happen. So by reducing the number of crises you have, can see a better effect, or what we say, if you have more crises, you're putting more pressure on these very vital organs that are keeping you alive. So by reducing the amount of crises, ultimately the amount of hospitalisation, you don't have lasting damaging effect. And that's why they offer bone marrow transplants to children, But we can hear more about.
I think it's great. She was asking for the.
Yeah, but you want it, because everyone's different in terms of pain.
Well, in terms of pain?
I think it's like necessary to have your opinion.
So yeah, I think when it comes to pain in times of crisis, is exactly what Nikki was saying. People have different types of pain in different parts of your body. I think the most dangerous one can be a chest crisis, when you get a crisis in your chest, because obviously that's where your heart is, your lungs are, and obviously you need more oxygen as well. So it's excruciating pain. I remember my wife was giving birth to our first child, and I was talking to the midwife, and she was like, "Oh, you got sickle cell." And she said, "You know, there's statistics that say it's more painful than birth pains, than labor pains." So apparently that's true. I don't know, so I'm a woman, but apparently it hurts more than labor pains.
So is that the only indication for sickle cell? Is there any other ways of finding out apart from just having pain?
If you have it, I think if you have full-on sickle cell from birth, you would know it's more likely that you will have sickle cell crisis. It's people with the trait that some of them don't have any symptoms or pains. I know people that are 30 plus that found out they've got sickle cell traits, so a lot of people don't know. This is why we encourage people to know their genotype, to get genotype tested, so they will know their genotype.
How do you go about getting that test? Because for me, I've tried to go through my GP and it seems like they have no idea.
That's a great question. So unfortunately, I'll leave it to a professional, but unfortunately, many people said that to me. I've tried to go and ask my GP for a genotype test and they said no. And unfortunately, people told me they've had to lie and say that they're about to have a child or they're getting married and they want them to get a genotype test, and that's when the GP is accepting. That's very frustrating.
Oh, honestly.
Especially with us trying to raise awareness and tell people to get to know their genotype. And why can we not go to a local GP and say, I want to know my genotype? It really helps. I'm not saying it like
No, I know. So to add to that, yeah, definitely just throw it back at them and say, actually, this is the fastest growing genetic condition, and actually, I need to know. It's not on a want to know basis; it's a need to know basis. Yeah. If you have to throw family planning in there, throw it in there. But I want testing, which is either you get diagnosed at birth, but they also test a mother 20 weeks into pregnancy. It's a bit late, and it's ridiculous. But we can HIV test at home now. So for the past last year, what's been really battling me is why can't we send out testing in the sexual health kits that you can get sent to your home? What I've come to learn is that there's different type of testing. Virology and hematology testing are done in different labs. But this is where we all come into it, because we've got to advocate for these happening.
Does it cost them money?
Yeah, of course it does.
So is that why they're pushing back with it?
I guess it comes down to understanding, but yeah, blood tests cost money. But it should, and money, working with finance for my whole since 19, money I thought was everything, and it really isn't, because without health you can't have money. Yeah. So let them know that. But yeah, so it is diagnosed.
To say no. There are 0 grounds for them to say no, other than just plain ignorance. So Christian to do it, like we pay taxes for the health service.
When in doubt, get a referral or get a second opinion.
Yeah. And it's crucial to get done. I think it's when I met my wife, it was that was no brainer for me. So if I found out she had the trait, I wouldn't have married her. So that's how serious I am about.
Until now, where you can go through family planning and have.
Yeah, of course. I would avoid it.
Yeah.
Because you just never know. I'm someone who believes in health over love. So my wife knows that, and we both agree on that.
Okay. All right.
So like she has family that has sickle cell. Some of her siblings have the trait. So when I met her and we was together for a while, I told her about my health very early. And I said, if we're going to continue our relationship, I need to know your genotype. She told me she was AA, I couldn't just take that. I asked her to go and get genotype tested, and I saw the paperwork myself, and then we got married. So that's how serious I think we need to be about knowing our genotype and minding who we get with.
And most importantly, so even though we are, I mentioned earlier that there's 4 of us from our house, my household, my mum's household, to have, my elder brother and sister have a father from Jamaica, and my dad's from St. Lucia. Mine and my younger sisters. It's actually my older brother and older sister that have trait. But my mum had 4 kids. And so when we reached our 20s, and I wanted to know my trait status, she said, yeah, question. I said, did you test me for thalassemia? Yeah. I said, they hadn't even started testing when I was born. You know? So as an adult, I needed to know. Yeah? Because we can't always rely on what our parents were told and what they can remember. And it's not her fault. 4 kids. 1, 2, there's, you know, 1 of them, 2 of them. But then most importantly, when I've got 2 girls, one's 13 and one's 7, and my youngest, Lola, she was presenting a lot of tiredness, fatigue. So I went to the doctors and got an iron test, and they said, has she got thalassemia? So for those that don't know, thalassemia is another blood disorder. Has she got, I said, I don't know. Can you test? And I knew she was tested at birth. And by this time she's only 7, and I've already forgot. Can you check? She doesn't have the trait, she doesn't have thalassemia, but it got me asking questions. Because I'd known about sickle cell, but I didn't know about thalassemia. And little did I know, her father has thalassemia trait. After 2 children, being a mother for 13 years. So there's no one to blame. But if we don't check and test, then the ignorance will get the better of us. Yeah?
Yeah, and I would say as well, if you go in with the mindset that this is essential information, you know, you're not asking, I don't know, for massages on the NHS, as nice as that would be, you're asking for something that's really essential information. Like I said, with my marathon experience and being hospitalised afterwards, it was at that point that I learned that people with the trait can have died in sporting events, and it's rare, not to scare anyone, but this is really essential information. I shouldn't be finding out after I've run the marathon and I'm in hospital, when actually my trait was confirmed when I was around 10. So I would say very much going with that mindset. And if you have to say you're actively trying for a baby, then do what you gotta do, I would say.
I've just got a quick question for Iggy, just because obviously you were in Leeds for some time, I'm from up north, and although I live down here, like, the thing is like, I'm intrigued as to the experiences that you had in healthcare, and I'm also a healthcare professional as well, so I'm intrigued as to the experience that you had up north versus actually being down here.
Yeah.
And did you have, what was the support like? Because I feel like up north it wasn't going to be great.
Yeah. Because I was in Leeds for let's just call it like 6 months, and like you said, it's different, and it's different everywhere. Because I was also in boarding school in Surrey, and it was funny because when the panel was speaking earlier and speaking about like paramedics and people who say sickle cell patients are the hardest to deal with. But up in Leeds, you know, I've had instances where I've called paramedics and they're in my room and they look at me like, I'm just going to be so honest, we've never dealt with sickle cell before, can you tell us a bit about it? And I'm like, so here I am in pain on like an 8, but I'm still going to try and talk you through maybe the possible things I need and And even going into A&E myself, I've been turned away a few times. Like the same thing we said of thinking it's like a drug thing and I'm just trying to like score some meds, but it's like, who is waiting 3 hours in A&E just to get meds and go, like, you know, I'm obviously here for something. So it's, I would say, honestly, my experience in healthcare has been very turbulent. I've had instances where I've had to discharge nurses of my service, and I had to find out I could do that because I had nurses that would treat me really badly, and obviously just based off that notion and preconception they have, but I didn't ask to be sick, so it's like, that's not my problem, and I'm not going to let you make that my problem. So I was really, like, I was really strong on advocating for myself, especially, like I said, I kind of, you know, lived on my own. So I was doing a lot of this by myself, and in a community or in the midst of people that don't understand, I had to really like voice up and say the things I needed for myself. I've had instances because I had to be taken to A&E in Surrey, and I was asking for pain meds for hours and hours and hours, and I wasn't attended to, and this was overnight. So if I went in 9 p.m., by 7 a.m. I still hadn't gotten anything, and I had to call up my healthcare team in London and UCLH, and they had to transport me via ambulance all the way down, and even from Leeds as well. So I've had instances where I've had to drive like 3 hours just to get the right healthcare.
So was your main team still down here?
Yeah.
Regardless of
Yeah.
what I was in,
Yeah, so I just didn't bother changing my team, and something that really helped me was I don't know what it is exactly, but it was basically like a letter from my healthcare team in London. So for wherever I was in school, wherever I lived, it was basically like a standard protocol they had to follow. So before we even get into, oh, what do you need and what's your pain like and what meds do you usually take, there's just like a standard procedure of what I need as a patient.